Here. Is that the right one?
There we go. Are we in? Okay, we're just getting more and more folks in here. Apologies for any of the confusion. It's had to re-up the invitation and the Teams and Zoom. So more than you need to know other than my apologies for any kind of miscommunication that happened. It's just good to see all of you here. So good seeing you. Um, for folks who don't know, my name is Bill Bainey, with Self-Sufficiency overseeing design implementation. Catherine Garland has been leading these meetings and James Barta. Congratulations to James Barta on getting a new position. So he's kind of moved out of this role, and Catherine Garland had to go back to her regular duties over at Snap with the EBT. But we think this is a critical group, and we wanted to continue moving. So I'm taking on leading this group for a while. Um, a few things if we could do. Folks have had the agenda. Does everybody have the agenda in the invitation? Folks get it? Just out of curiosity. Thumbs up, thumbs down, head nods. Rob,
Yes.
Rob, I'm looking at you. I'm seeing a no.
I'll be sharing it again on the screen.
Okay, beautiful. Okay.
Probably me. I just didn't check.
Oh, great. There we go. Okay. Okay, so folks got it. Fabulous. So what we're going to do is, if you don't mind, in the chat, if you would mind putting your kind of your name, pronouns, and organization and role inside the chat, so we just have an idea of who's in the room. That would be wonderful. For today's agenda, we have Claire Siegman, SSP Director, is going to give you some updates. And we also have fortunate to have Cheryl Miller, who has leading the efforts within ODHS around community engagement and going to be reviewing a number of strategies and a number of things that have been underway within ODHS, and actually an opportunity to gather some of your voice and gather some of the insight that you bring. Um, and at the end, just any kind of feedback, questions, or suggestions you may have, we just want to make sure we have a space at the end for your voice. Um, Obviously, this is a very fluid discussion, hopefully, and an opportunity to get your voice throughout this process. So I truly invite you, as you're hearing things, either with Claire, Cheryl, myself, or anyone else, if you have questions, don't hesitate to raise your hand, chime up, come off mute, however you'd like to offer it. We want to make sure that we get your voice in this conversation. Um, that being said, I do wonder, Claire Seagreen, is Claire in the room yet? Okay. I don't think she's here. Crystal's Claire not here yet? Okay. Well, I will offer this then while we're waiting for Claire, because I don't believe Cheryl's with us yet either, and I want to make sure we give Cheryl an opportunity to jump in. Um, we're still getting some additional folks trying to get in, Sasha?
Claire will be here at 2:10 per Crystal, just so you know she's currently in another meeting. And I'm letting people in as they are showing up. So we do have a few others coming in, but we are waiting on Claire till that 2:10 mark. So
Love
about a
it.
minute.
Not a worry, not a worry. Um, as we're waiting for folks to jump into the meeting, it would be if folks have any specific items that they think they would like to cover or make sure that we speak to today, please drop that into the chat so we can make sure we cover it. Any kind of questions you may have or topics you want to get covered today, we want to make sure Claire and or others are able to talk to that. So if you do have anything you'd like to offer, questions you may have, some considerations, we'd love to hear a little bit more from you. You're all in the Teams link. We'll move people over from that Teams link.
Looks like there were a few still that were in the Teams chat. And Claire had sent the link to everyone. So I'm watching that one as well.
Love it. Thank you so much. Let's see, Claire, are you with us? Okay. Well, we'll get Claire in a second. I hope everyone's enjoying their day today. Not really wanting to hold court, but definitely would like to make sure we maximize the time here. Again, any for folks that are jumping in late, one of the invitations, if you have any topics you'd like discussed from ODHS, SSP today, please be sure to drop that into the chat and we make sure we can cover it. If you have any thoughts or suggestions about not only this meeting or upcoming meetings around topics you'd like covered, please, would love to hear that as well. Okay, hearing none coming through. A lot of invitations, a lot of introductions. Great. Great. Seeing some familiar faces in the chat. It's nice seeing all of you.
Hey, Bill, did anybody tell you there were a bunch of us trying to get in without the link?
Yeah, actually, I
Okay.
think Sasha
Yeah.
and Chris have been working on that. They changed it over. Thanks, Beth. So, Beth, would really appreciate hearing from ODHS if there's any insight into why the drop in SNAP enrollment exceeded what the agency expected, 70,000 fewer people are near per Nate Singer. Is a report run on the reason codes for people dropping off SNAP? Great question, Beth. We'll see if we can get that. We'll see if we can get some information on that one for you as well. That being said, Claire, would you be you ready to go for your updates?
Yeah, and I'm actually just going to turn this straight over to Cheryl because we're running a little bit behind schedule, and what I have to say isn't nearly as interesting or fresh as what Cheryl Miller needs to say. But before I turn it over completely, I don't have the answer to the SNAP question. I would love to, but hopefully we've got somebody on the call who will. Any questions for me that are specific that I might answer or take away from anyone before I just sign off my time? Next month, I will probably have a fairly significant transformation update. I thought I might have one today, but we're still sort of in the middle of a few things. So I'm looking forward to sharing more about what's happening with the agency next time around. All right, so I'm going to go ahead and turn the mic back over, Bill, if that's all right.
Yeah, it's Cheryl. Welcome, Cheryl. Are you with us?
Thank you. And I do have a presentation. I don't know if I can share it or if someone else is going to share it. I'd be happy to share the
That'd be great.
presentation.
I believe Sasha can give you controls.
Okay. Sharing is not turned on, so I'll wait a minute.
I'm getting it. Sorry.
No worries, Sasha. Flexibility is always important.
Isn't that the truth? It's the number one skill needed these days. Yeah.
It really is.
Cheryl, as you're waiting, perhaps you'd like to introduce yourself.
Yes, I can definitely do that. Oops, let me see if I saw it where I can click on it now. Oh, it's allowing me. And I want to go to this screen here. A little different than Teams. Oh, that's interesting.
Beautiful. We can see it.
I'll get this out of the way. There we go. Can you see my screen? The presentation? Do you see Office of Community Engagement?
Sure
Yes,
do.
we do.
Okay, good. Is this trying to show me a calendar and all kinds of things? Let me see if I can get you guys back. There you go. I can see you. How lovely you all are. My name is Cheryl Miller, and I am the Community Engagement and Strategic Partnership Officer for the Oregon Department of Human Services. When I was thinking about meeting with you and I saw this photo, it really explains why we are all here. We are here to serve Oregonians. I know there are many partners on this call. And as the community engagement and strategic partnership team, we're here to make connections with partners. And you'll hear about a few things that we have been doing as I move forward. And I'm also going to introduce our team to you. Several of the folks on our team you've already met. They've made presentations at these meetings before. So that's why I'm not going to talk in detail about all of our projects because they've been here and shared with you. So I've already introduced myself. We have two primary community engagement team members, Stephanie Stevens. If you attended any of our Together We Learn sessions around the agency request budget back in January, we had two sessions in um, person. One was in Salem and one was in Portland, and the other was virtual. Then you would have seen Stephanie because she led that work. And it was one of the first times that the agency actually went out into community to connect and really talk to folks about how the agency request budget is developed. And um, we wanted to hear the values that folks had. What did they believe we were supposed to be focusing on? And so we did get a lot of feedback. In November, we also did a survey and we had over 867 responses to that. Maria Waters is our community and faith-based strategist. She's probably the person you're most familiar with. And she is also the FACT community engagement lead. So you will see her in those spaces as well. And then you see Delilah here. And Delilah, she is our administrative project support specialist. And I tell you, if we need to get a meeting quickly scheduled or project support, she is always there for us. And we're so grateful and thankful for that. And I, if you connect with this team, those are some of the frontline folks that you will be engaged with. Now, we also have three project managers, and these project managers are so critical to the work that ODHS is actually involved with right now. Choa, she has worked with APD and some aging and people with disabilities in some of their high profile projects and is just about completing those. She's also worked with government relations and also with the Office of Tribal Affairs. Sachi, she is working with HR1 and several other projects. And Amanda, she is working with transformation. So anybody involved in transformation will hear from Amanda on a regular basis. There's more yet to our team. Greg Ivers, he's known as the State Business Outreach Coordinator. And you will find him working and leading the governor's marketplace events. If you've ever participated in them, you'll see him with OWAMI if you've ever been involved there. But if you are a nonprofit organization and you've just got questions or a small business, I would say Greg would be the person you want to connect with. He really knows a lot about all the resources that are out there. And so you'll be able to reach out to him. I believe Greg's been here too. He works a lot with the CPCs. Heather, she is the OHA State Business Outreach Coordinator, and her and Greg work closely together, and you see them in all the same places. And Amy Church. She leads our volunteer and intern program, and I can see some folks that have worked with her or currently working with her. If you know anyone that wants to volunteer at ODHS, I would encourage you to reach out to Amy. I can tell you there's some wonderful stories where people have volunteered and now they're employees. So never think that volunteering isn't worth it. Also, she works with folks who they're in a university and they would love to intern at ODHS. So there's opportunities there as well. Any questions about the team members? I'm curious, has anyone worked with any of these team members that I mentioned? Heather or Maria? Yes, I see that. Thumbs up. Yeah, that's great. Great. Thank you. Oh, I'm excited. I see so many. Yes, that is so awesome. So we have a great team and they're doing amazing work within the community and internally here at ODHS. And you'll hear more about that in a minute. So I thought I'd just share, here's what we're up to. Civic Roundtable. I believe Stephanie came and spoke with you about Civic Roundtable. It has taken us about 6 months to get through the contracting process, but it is a fully executed contract right now. And the next steps are developing the use case for each of the programs that will be working with Civic Roundtable. And so, what we are calling this phase of the work is our deployment phase. We'll have some meetings with Civic Roundtable towards the end of the month with all the programs that are involved. So you're probably wondering, who are the programs that are working with us? We did a partnership with the Oregon Health Authority. So their community engagement team with their regional coordinators through, many of you know them as I call them formerly known as the CPOP team, John McDade, Oliver Vera runs those programs, and we partner with them along with the Office of Resilience and Emergency Management, with the VOC Rehab, also the Office of Tribal Affairs, and did I leave out in community engagement? I think I got them all. And so we're the ones that are going to be working with this project. We will start internally first and building our internal processes, and then we'll move out to engagement with partners. It's really exciting, and we believe this is going to be a game changer for us. One of the things that I've been really interested in and others is being able to truly co-create with our partners. And I don't know if you've tried to do that in some cases, but we use Outlook, and most other folks use Google products. And so having a space where we can come together and really have those conversations and work on documents together, or just a place where we can find resources. So you will learn more as we move forward. Our phases to fully operational will be about 3 months, just to ensure everything is up and ready to go. The next area I'd like to talk about is Together We Learn Human Services in the Oregon Legislature. Folks have a lot of questions about this. And in July, we're going to have the opportunity to have meetings to actually connect with folks. One of them is going to be in Portland at the University of Oregon's campus there in Northeast Portland. And then the other one will be in Salem at Broadway Commons. The third one will be a virtual meeting. And as we move forward, I have a slide where it will show where you can find that information. Tribal governments are invited, community-based organizations, nonprofits, faith-based organizations, individuals, advocates, legislators as well. All is invited to really learn about the process. The key is, where can others get involved? As an agency, we can't advocate for ourselves. We can give factual information to the legislature, but we can't advocate like others can. And so we just learn where the points are, where people can share what they believe is important to their organization or the communities they represent. We've also will be launching a procurement collaborative at the end of the month. And this is a project that is in the initial phases, but what we really would like to do is be among nonprofits that have great grants and also contracts through the Oregon Department of Human Services. And we want to listen to you. We want to learn from you. We want to develop new outcomes and new experiences because of what we learn together. We're able to implement new processes to improve the experiences that grantees and contractors have. We want to build trusted relationships. Not to say that we don't have them, but in some cases we may want to improve. And around the contracting and granting area, there's always a lot of questions and a lot of processes that we can come together and determine if we can implement some things that are within our purview and make a difference. So more to come on that. And if you're interested, please feel free to put your name and organization in the chat, and I believe Sasha can get that to me and we can reach out to you. Greg and Heather are the two that are leading this effort. And so if you know either one of them, you can also reach out to them. This next project that we're working on is an internal project, and I know most of you are partners, but I thought you might be interested in hearing about this. We're hosting what's called a Beaver Duck Innovation Classic. And this is going to be a really cool event. Have you ever heard of Shark Tank? Well, if you've ever heard of Shark Tank, then you will know what this will be like. We sent out a survey to all of our staff, and the focus was really on frontline staff. And we received 149 proposals on things that folks felt like if it were changed, it would make their work life much better. And it would help the folks that they serve get services faster or more timely. It was just really amazing, the heart of the people that submitted these proposals. Well, next week we're going to be having the Beaver Duck Innovation Classic, and I keep talking about that, and you're probably wondering, what is that? How many of you have seen Shark Tank? Give me a thumbs up if you've seen Shark Tank. I think a lot of people have. Well, it's kind of like Shark Tank, but we couldn't call it Shark Tank, and we couldn't use the ducks and the beavers really, so we had to come up with something else. So our team is helping folks prep for presenting their proposal. And we have a panel of folks, a very diverse panel of folks, including labor leaders. And they're going to determine which ones we move forward. These are projects that can be completed in 90 to 100 days. We also are going to have as many staff who want to join this Zoom meeting, and they're going to be able to vote. So we'll look at the voting of staff and the voting of the panelists, and that will determine who moves forward. This is our first time ever doing this, but it's exciting. And what we've heard from staff is they would love, because they are on the front lines, to give us feedback and ways to change things that will improve their work processes. And so we're excited to see these get implemented. So as a community engagement team, we're not only working directly with partners and tribal nations, but also we are working with our staff, internal staff. This is a little unusual, but I think we're going to see some really positive results after this is all completed and everyone's projects are approved and implemented. And that's the key. We want full circle. We want them to get implemented. Before I go on, I'm wondering, does anyone have any questions? I know I personally have been everywhere today, so this has been really fascinating for me. I've been in an all-day in-person meeting. I thought it was going to work from that location, but they couldn't get my computer connected properly, so I came home. And so this has been, I feel a little rushed, but I hope that you were able to really see all the wonderful things that we're doing. And there are many more projects we're involved with, but I just didn't want to list every last one of them. I'm very open to hear from folks. So if there's questions that you have specifically for me or the team, oh, Claire, you have your hand raised up.
Well, I do. I just wanted to share a little bit of perspective, and I've said this before, but this just really demonstrate I think putting our walk in the walk and to commit to community engagement. One of the really great things about ODHS in the last few years is that there has been a verbal out loud commitment to community engagement, and then it is being built out. And the investment in Cheryl's team and all the different projects and all the new tools, from comms tools to public meetings to budget engagement and all of that, I think it's just, I've been here a little while, but not too long. And this is a level of commitment, I think, to engagement, authentic engagement, that is really fabulous. And I just want to say, Cheryl, I think your leadership, it's kind of sets us apart a little bit in terms of what we've been doing. I've been hearing really great things about the work, and the attendance in all kinds of venues is just growing. So I think it's working for folks. I'd be curious if folks on this call feel the same way. But from my point of view, as a director of an important series of programs, the feedback that you all have been able to get for us, I mean, we're definitely making better decisions because of it. And the tools that you give me as a director are amazing. So I just want to say thank you publicly for this.
Thank you so
and
much.
to acknowledge our director's office leadership and investing in it, because we knew we needed to do it, and now we're doing it. And anyway, just very happy with the whole investment here. Yeah, so thanks.
Thank you so much. We're behind the scenes a lot. For example, and really, Claire, you made me think a little bit about this. When all of our program directors were going out and having conversations with their advocates and their key partners, we prepared a slide deck for them and talking points, and really help prep folks with that conversation because of the work that we already had done around the agency request budget. So it helped smooth that. Maria Waters on our team, she works really closely with the community, the CPCs, and she sends out regularly, weekly materials, PowerPoint presentations, talking points, so that those CPCs, when they're out in community and talking with you, can talk about the things that are related to HR1. That's really important. What we're really seeing is we need to be sure that everyone, thank you, community partner coordinators, and to make sure everyone has the information and that it's clear, it's understandable. We're also working on other projects that will involve participant focused materials that community partners could have. So there's a lot of work going on around HR1 and other projects that are always focused on how we can improve our relationship with our partners and how can we ensure that the people we serve have what they need. And that's really critical to the work that we do. We want to make sure that we're inclusive. Part of the work that I did before I came into this role was lead the Office of Immigrant and Refugee Advancement and the Welcome Center. And so really making sure we have culturally specific information available in other languages. All of that is important to us. Now I'd like to ask you a question. Is there anything else you would like to know about? Is there something we can do? If your organization ever wanted to have one of the sessions that we've already put together, either the agency request budget sessions that I talked about, or even the upcoming ones, we also will come to other organizations and provide that if that's something desired by that organization. So I'll pause there for a minute. Nancy, yes.
Hi, Cheryl. Thank you for this information.
You're
I
welcome.
kind of keep my ears perked up when you said volunteers and people joining you. And I just want to make sure when you said joining you, did you mean your organization or did you mean out here in the field and people that are trying to get to the individual geographic regions? And I just thought that maybe if I was confused, our partners may need a little bit of
Sure.
clarification.
Well, I was more talking about if you wanted us to come to your organization, meaning the partner organizations, and they would like to hear one of the sessions that we've already done for public or one of the upcoming ones, we're open to that because we want people to have that information. And sometimes on the dates that we have, a group may not be able to get there, but we're more than happy to do that for your organization. We want to be flexible. We want to be supportive of the work that you're already doing in community. Thank you for that question, Nancy. Now, I don't want to take up all your time. And I know this is a little different topic than some of the interests that you all have that's in all of our minds and hearts today about work requirements for SNAP and Medicaid coming up soon. So I'll pause for one more second and see if there's any other questions. Also, I'll put well, you don't get to keep this, but I'll just drop it in there. You could grab it. Let me get to the chat and I'll just put my email in there. The slide that you're seeing now is where you can find community meetings and updates, and it might take me there. Let's see. Yes, and this is where you can go. You can register for the sessions coming up. As you can see, Monday, July 13th is coming up soon. Thank you, Bill. And that's the virtual session. The one I mentioned at the University of Oregon is on the 22nd, and then on Thursday, the 23rd in Salem at the Broadway Commons. It's great to register. It helps us to be prepared. We usually have some light snacks and coffee, tea, and water service. They're available to you as well. This is interactive sessions. This is just not us talking to you. So you get to have some usually table exercises and then some other exercises along with more information. I heard someone getting ready to say something. What was that? Did I miss it? Or maybe
It unmuted on accident.
Oh, unmuted on accident. Okay, thank you. Well, that's all I have for you today.
Cheryl, I really appreciate your time, and I would just echo what Claire mentioned. I really appreciate the thoughtfulness that you're taking to engage community,
Thank you.
and as a real partner,
Well, thank you.
do with. So very much so. I invite those on the call, our partners, please utilize that resource as much as you feel possible. And any suggestions you may have, or thoughts you may have, or questions you may have for Cheryl or for the community partner team, please don't hesitate. My experience working with Cheryl, with you and the team has been nothing but very positive and very responsive to some of the thoughts, some of the questions folks have. So great work. Really, really
Excellent.
appreciate it.
Well, thank you so much, Bill and Claire and everyone on this Zoom meeting. I dropped my email address in chat, so if you have some thoughts later you'd like to reach out to me, please let me know. And if I can't answer it, somebody else on my team may be able to answer it, or someone else, and we want to definitely be supportive of that. Thank you, and I hope you have a wonderful rest of the meeting.
Thank you, Cheryl.
And I'll
Appreciate it.
stop sharing.
Thank you.
You're welcome. Bye-bye.
Bye-bye now.
Bye.
Well, thank you so much. And again, please take advantage of the invitation. There is a link to the community updates page that Cheryl outlined in her presentation. Um, I again invite folks, if you aren't able to attend one of the sessions, I think the invitation is there for Cheryl and or her team to come to your organization to provide a little more guidance and a little more insight and an overview of that information. So wonderful resource. We are at a time now that it's really kind of a roundtable and getting any of the questions that folks may have, or some updates from our community partners that they may have for themselves and for to share with others. Anything that people have that they like to either call out, questions they may have, or updates from your programs, or updates about services that you may want to share. Okay, just waiting a second, kind of give that respectful. All right. Um, That being said, I want to honor and respect people's time. If you do have any kind of questions, have any thoughts, please don't hesitate to reach out. My contact information, I'll drop into the chat as well if you have any things for me. Yeah, Beth.
Sorry about that. My unmute button moved. Apologies. I am wondering if there is anyone who could answer the question I put in the chat at the beginning of the meeting. I think it's probably on everybody's mind on all the, partners you've invited to the call. How many people drop from SNAP and wondering, what are all the reasons? And is there anybody that could talk about that? I have seen from another state, specifically from New Mexico, a report there's a monthly report that's run that gives the reason code for each drop, or like how many drops were per this reason code, how many drops were for this other reason code. And so I'm wondering if there has been something like that ODHS could report on.
I'll offer you this. I don't know if anyone's on the phone on the line rather that can offer more detail. I think Claire may have alluded to it. I do know that is actually something. There's a report right now that's in the works. It's being developed. I don't have the ETA. I know it is prioritized, and we're trying to get that data out as ASAP. But I don't have. I would be disingenuous to say, and it's going to be out by next week, right? I just don't know the timeline of that. But I do know that is something that it is a report that is being worked on. Is there
Would that be
any?
something you could share with us, with the mailing list that gets this group
Absolute
invitation?
great suggestion. Absolutely. Once we have that information, I'd be more than happy to share information we can share with this group, and I could put it on the invitation list, or I'll have one of the admin team to help mail that out to folks.
Bill, I'm happy to chime in a little bit more if that's helpful. Hi, everybody. This is Maria Waters. I serve as the lead for community engagement for the federal response. Beth, what Bill said is true in that we don't have an ETA, and I don't want to overpromise and underdeliver. But what I can say is that there has now been an adopted comprehensive data and research request to deliver a lot of what you're saying. and then some. And the intent is to have that be a transparent, accessible database for partners, local county governments, and others to be able to access, to be able to really drill down, not just at a statewide level, but also the local level, what is happening in each community to best deploy resources in hopes of helping folks retain and also regain benefits. So again, we're a little ways out still from having that, and I know that that's frustrating. And also, it has been formally adopted, and our research and data teams are in the works of doing that. One slightly different thing that may be different than New Mexico is we're balancing our one system with the multiple eligibility programs along with Deloitte. And so we don't house all of that information in-house. A lot of that is in Deloitte systems. So it requires some extra agreements and capacity to be able to get all of that. So not that all of those weeds matter. We know it's really important. They're working really hard to get it as soon as possible. And we are much further along down that road than we were even just a week or two ago. So more to come. Oh, and I should add, in terms of accessing it, they're working on a web page on our website that will be customized just for community partners to be able to access all kinds of information in one spot, not just these data reports, but also partner-facing materials that are in the final stages of creation, access to one-pagers that are going to be released soon, and some other toolkits for community partners who are supporting individuals impacted by both SNAP and OHP work and activity rules.
Thank you, Maria. I'm really glad you have much more in-depth information than I do. So great. Thanks, Beth, for the question, my friend. Any other questions folks may have outside of that? We'll be on the lookout for some of the information that Maria outlined. We'll be sure to post it and get it out to people as soon as it's ready and as soon as it's completed. Um, if folks have any thoughts or questions that they'd like to offer, don't hesitate to kind of reach out to myself or Sasha, who you should have on the invitation as well, about upcoming topics or recommendations. Other than that, I wish all of you well, and we look forward to seeing you next month. Take care, everyone.